Good afternoon, Madam Chair Anderson and the member of the committee. My name is Chunhuei Chi. I am a health policy and international health professor at Oregon State University, and I'm here to speak in support of the Senate Bill 631. My expertise in healthcare system, besides teaching and research, I also volunteer both locally in Oregon as well as nationally for the congressional HR 676. That's the health, Medicare for all Americans. In addition, I also serve as a policy advisor for Taiwan's national health insurance, which just celebrated 20th anniversary. And besides, my colleague already said a lot about the rationale for supporting a universal health care. I would like to start by saying I'd like to present a slightly different picture about what healthcare system is about. When a person is sick or injured, at that time, no other social institution is more intimate, more close to the person than healthcare system. And it is through the healthcare system, the person who is sick or injured feel either the warmness or the coldness of the society. In other words, a healthcare system is more than just an organization that delivers healthcare. A society's healthcare system is actually an integral part of the social institution. Through the healthcare system, we demonstrate what is our value. Through the healthcare system, we also demonstrate who we are as a person and as a society. At present, in our society, we treat healthcare system as just like other organizations that produce healthcare and deliver healthcare. And I'd like to quote my colleague, Professor Reinhardt from Princeton, who is also serving in the same capacity as a health policy advisor to Taiwan's national health insurance. He described our healthcare system as we treat patients as both object of human compassion and cash yielding biological structure. Now, let me quickly summarize some of the key problems as I see it, again, from my colleague, Professor Reinhardt. See it. First, everyone knows we still, despite the HCA, we still facing uninsured. My colleague already mentioned. Some an individual would rather pay the fine, which is much smaller than the unaffordable premium. Despite the HCA, our premium remain unaffordable. And the high cost, let me give you an example. In 2014, the average premium for a family of 4 was $16,834. That figure was 70.6% of federal poverty line for a family of 4. And that just shows how expensive it is. Despite our healthcare is the most expensive in the world, at the same time, it produced low accessibility. Again, let me give you one example. For the same or next day appointment for a doctor, in the U.S., in the most recent study, 43% of Americans report they have the same or next day appointment. Compared with, for example, 2 other nations has universal health care. France, they have 62% who can get the same or next day appointment. British, 61%. So our high cost of health care not only yield low accessibility, but also relatively low quality. Again, my colleague already presented some of the indicators. I just want to show one more, which is in recent years has been seen as most sensitive indicator of healthcare system. And this measurement is measuring mortality that can be prevented through healthcare. And U.S. ranked the bottom within a group of 16 OECD, the high-income country. The U.S. number is 96 per 100,000. France, 55. Italy, 60. In addition, we also have high administrative cost. Again, let me give you some example. In 2012, the per capita administrative cost of insurance in the U.S. was $631. Compare with that in Japan, $54. Between 1980 and 2005, the administration of health insurance in the U.S. increased 12 times. Those high costs and generate relative low access and low quality give us the conclusion that U.S. healthcare system is not only high cost, but also inefficient. And high cost and efficient together, they also driven people to be unaffordable to healthcare. In addition, our financial burden is inequitable. For all other nations with universal healthcare, their financial burden of healthcare is usually reflected in their ability to pay. Whereas in the U.S., our financial burden of healthcare has little to do with ability to pay, but have everything to do with your condition of health or illnesses, and whether you are employed and your employer provide health insurance. Now, let me summarize. What's the potential benefit if we implement a universal healthcare system like the Senate Bill 631? Of course, the number one benefit will be universal, that no one will be left out because of he or she belong to any category. Every Oregonian and resident will be covered. The second benefit is efficient, that can address many of the problems I mentioned, including high costs, high administrative costs, and also my colleague mentioned about drug cost. The drug cost between 1980, the prescription drug cost between 1980 and 2005 increased 20 times. And that's the fastest growing cost. We have little control over it. With the universal single-payer system, we have the capability of negotiating the drug cost. The drug market follows the international market. The bulk purchase gives you leverage to negotiate discount, which is why our neighbor Canada and Mexico has a cheaper prescription drug, even though the drug was made in USA. The third benefit of universal healthcare is equitable financial burden, that under the proposed system, we can structure the finance so it reflects people's ability to pay rather than reflect people's degree of illnesses. And the fourth benefit, which is seldom mentioned, is the universal healthcare system has the capability to integrate health insurance with health promotion. They can be under the same entity or related coordinated entity. So our healthcare system is not just providing health insurance, but also taking care of people's health. And the last two benefits are related. Number 5 is innovation. I just came back from Taiwan's 20th anniversary international symposium. And during the symposium, they were talking about new innovation. One of them is Pharma Cloud, that doctors and contracted hospitals, they can access a patient's drug history. Any doctor, any hospital. And the information is not only passive, it's also active. For example, if a doctor prescribes a duplicated drug, the system will warn the doctor. Likewise, if the doctor prescribes a drug that can interact with existing drug, the system will warn the doctor. Another new innovation related with information technology is Taiwan is implementing My Health Bank. By next year, it will allow everyone in Taiwan to access his or her own medical history. And you can know where you have been. And I'm taking this to example, not because Taiwan has the best information technology. In fact, many of those information technology, U.S. is far more advanced. However, Taiwan has a platform, the universal single-payer system, to implement them. We don't. And so this is kind of a side benefit of a universal healthcare system that allow us to integrate the information technology that we have, but we don't have a platform to use them. By integrating them, it not only saves cost, but also improve population health. And the last benefit is accountability and governance. I always jokingly talk with my colleague and students saying, because we don't have universal healthcare system, when I attend those international conferences, my colleagues from other OECD countries, they all talk about issues, policies of the life after universal healthcare. And we're still talking about the life before universal healthcare. One of the big issues of the life after universal healthcare is governance, which in recent years has become one of the highest issues among the countries that already have universal healthcare system. The issue of governance is, in a democracy, people should have a voice to reflect, to ask what their healthcare system should be. And that seems to be a dream too far for Americans to think about, given our current system. But with a proposed universal healthcare system, we can build in that governance, that more responsive to the general public. In conclusion, Oregon has been known to be a pioneer and innovators in health policy. When I attend many of the international conferences in different parts of the world, my colleagues will always praise how innovative we are in terms of health policy, despite many of them have no idea where in the world is Oregon. So sometimes I have to carry a Pacific Northwest map to show them this is Oregon. And I urge the committee to consider the improvement and possibly support for these single-payer systems to continue our innovations, that we can show once again, not just to the United States, but to the world, that we can do. And potentially, we can build this system so other states in the nation, and hopefully, in the end, the whole country can follow. Thank you.
Thank you.